Hello, welcome everyone to this webinar between Unitar and Empower School of Health. I would wait a couple additional minutes for participants to join and then we will start. Okay, I guess we're 5 minutes into the webinar, so I'm going to start. Hello, everyone. Welcome again. My name is Miriam Pucarella, and I will be moderating this webinar today. I work at UNITAR, the United Nations Institute for Training and Research in the People and Social Inclusion Division. Among the many partnerships that division has, the one with Empower is one of the most successful ones that we have, promoting careers in health, procurement, and updating course material to address current challenges in health, such as supply chain management or digital health. I'm first going to explain the structure of this webinar. First, we would like to learn more about our audience before the webinar starts. So I will be conducting a poll to learn more about who is attending. Then Mr. Nicolas Tabagniti, our keynote speaker, will give a presentation to provide us with the Empower School of Health perspective. After that, two alumni graduated from a course in August will share experiences, Ms. Maires Kamanga. And during the webinar, the Q&A box will be available for you to ask our panelists questions that may arise. And at the end of the presentations, we will have a Q&A session, and we will go through the questions and the panelists will answer them. Please, if you mind, specify to which panelist each question is targeted, or if it's just a general one. Also, at the end of the webinar, I would be asking an additional poll that will be conducted to check if the information has been clear and prepare for other future webinars. I hope everything is clear, and please use the chat if there's any issues that may arise. So first, I will now release the poll to get to know more about our audience, who's behind the screen, and have a clearer approach during this session. So please take a few minutes to fill in the poll. Thank you. So if you could participate in the poll, answer the questions. It's just 9 questions, and it's for us to get more insights on who's participating in these webinars and how to target them more appropriately. Thank you. There's some people already answering the questions. Thank you. I see more people participating. Thank you very much. So far there's 35 people, so still like at least half of the participants. I will wait a couple more minutes and then we will start. So just some main findings. Most of our audience today, it's male. Their age range is between 30 and 40 years old. Most of them located in Africa and the Middle East. Their main academic background is pharmacy diploma, bachelor's degrees, or pharmacy masters. And logistics and supply chain is the other main academic background present in this webinar. Around people with 10, 15 years of experience are participating today. And they mostly work in NGOs or private sector. Their area of work, most of them is supply chain, so to 32% of participants. And they mostly work in hospital or other organizations. We would really appreciate it if in the chat you would specify which organizations other than hospital, wholesale, manufacturing you work for. Yeah, I'll give 2 more minutes and start. Oh, hello, Emmanuel. While we're finishing the poll, let me also introduce another speaker, Mr. Emmanuel Mana. He's been having some technical issues, but let's hope he can participate in this webinar also to present his personal experience. Okay, I'll end the poll. So now let's start the webinar. Let me explain why the topic covered today, which is health procurement, is an important issue for future health professionals. Health procurement, it's crucial for several reasons, which collectively contribute to the overall effectiveness, efficiency, and equity of health systems. It ensures the availability of essential medicines, medical devices, and supplies, which are vital for effective healthcare delivery. It promotes cost effectiveness and efficient budget management by securing quality products and best prices, thus optimizing limited resources. Moreover, effective procurement drives innovation, stimulates local economies, and supports overall economic development by involving local suppliers and creating jobs. Thus, health procurement is foundational to the quality, efficiency, and equity of health systems. And for this reason, it's why we are doing this webinar today, in order to give more insights about how to develop a career in health procurement. I will now give the floor to Mr. Nicolas Tabanuti, a global procurement and supply chain management expert with a career spanning for over 18 years. He has worked across the supply chain management domain on multi-million-dollar budget leadership programs. So please, Mr. Nicolas, the floor is yours. Share your presentation.
Good morning, good afternoon, everyone. I hope you're well. So my name is Nicolas Tavanuti. I'm working for the supply chain management for over 30 years in many countries in Africa, Asia, all over the world, in fact. And I'm currently working for Empower School of Health. So now I'm going to present to you some slide about the careers opportunity in the supply chain management. Maybe some of you are working already in the supply chain. Maybe some of you try to find out what they can do in the future. So we are with UNITAR, we have a special course. We call that a Master of Science. So everything is related to these courses, and please keep in mind that when I'm speaking about supply chain management, we are speaking about this specific course, Master of Science, handled by Unitar and Empowered. So next slide, please. So why should we consider a career in the supply chain? I'm not sure your background, but apparently most of you are pharmacists or have a degree of pharmacy. Maybe you are not. So please keep in mind that when I'm talking about pharmacists, I'm talking as well to the others who are not pharmacists. But most of the time, we refer to pharmacists, nurse, doctors, etc. So the problem we have right now, it's why do you need more qualification? For example, why pharmacists need more qualification in the supply chain management? Because supply chain management sounds easy. When we hear that, when listen these words, it sounds easy. But what about the supply chain management of health products, which is different? Who do you know? Let's say that why do you need more qualification? You are a pharmacist, you are a doctor, you know already many things about the medicines, but there is a misunderstanding about that because most of you are not trained on the supply chain management, especially on the supply chain management of health product. If you see on the right side of the slide, this is a research, and in this research, it's mentioned that on the supply chain management, professional certification and academic or training consistent with the supply chain function they wish to undertake, particularly in such training. That's mean, in fact, all the pharmacists are not trained for the supply chain management. I don't know if your university or in your school, you have a specific courses on the supply chain, but I'm not sure. I know that in Vietnam you have, it's an obligation. When you are in a school of pharmacy or let's say a nurse, you need to follow some kind of 1 year of supply chain management courses. Without this, you cannot handle a supply chain management. So being a pharmacist, a nurse, or a doctor does not qualify you to operate a health supply chain, especially when we are talking about millions of dollars. Part of the problem right now, it's plugging a health specialist in the supply chain. And with that, we fail to deliver the result. We have a weak supply chain management in the public sector. It's not because you take a pharmacist who knows about medicine and plug it in the supply chain that you will succeed. Most of the time, you fail. It's not only managing medicines. There is a lot of other commodities to manage. Mm-hmm. You have commodities, you have health equipment, etc., etc. So many things to manage, not only medicines. What we need in the supply chain management of health product, we need leaders, we need managers, we need this kind of skills. You need to take training on procurement and supply chain management to get these skills. Next slide, please. So you have a statement from the Ministry of Health saying when you use a nurse or a physician as a logistician, you lose the nurse or physician and you don't get a good logistician. It's very clear. That means in the supply chain, most of the time we say, okay, you pharmacist, you're a nurse, we're going to plug you on the supply chain and you will manage it. You will see it's very easy. It's very easy. It is not. Being a pharmacist or a nurse or a doctor does not qualify you to operate a health supply chain. Again, what you need to understand is at the end, what we are losing at the both side. We are losing a pharmacist or a nurse because this person doesn't have a specific train on the procurement and the supply chain management. And on the other side, we lose a good logistician because as you were not trained, the supply chain will be catastrophic. So the training is very, very important. The training we propose, Empower and Unitar, is a combination of medical knowledge, management skills, leadership, and procurement and supply chain management skills. Not only knowledge, but skills, both of that. Next slide, please. Well, here, what skills are needed? I'm not sure you're gonna have these slides, but anyway, you see on a link provided by People That Deliver, PTD, and you have around 67 pages of skill required to manage a supply chain. 67 pages of skills, which is a lot. So this was produced by many partners. You have UNICEF, WHO, Empower, many partners. So ask yourself, how many skills do you think you have in these 67 pages? Next slide, please. So why don't we have people with these skills? Well, it's very simple. As I mentioned earlier, you have few schools of pharmacy or nursing medicine that teach procurement and supply chain management. You may have 1 hour, 2 hours, but it's not it's not deep enough for you to become a specialist on the supply chain management of your product. At the same time, you have few management schools, they don't teach public health. No finance, IT, transport teach public health. That's a big issue. So that's why we proposed some specific training for you to become specialized on that. If you don't follow this training, you won't be able to manage a supply chain management. We are talking about million dollars. It's not a simple thing. That means you don't go to the 7-Eleven next door and buy something. It's much more complicated. We will see that on the next slide. Next slide, please. So why haven't we trained people? Well, we've trained people. We trained for years, for decades, for 40 years, for 30 years. The problem, we failed. We failed. We sent people to some kind of, they said, yes, it was training courses, 1 week training courses, but we sent people to sleep, The people were bored. They don't like what we were talking about, That was a very, it's an issue. For 40 years, 50 years, we didn't train correctly the people. When I say we, I'm not responsible. But when you see, for example, training on supply chain management, you go there, you stay 1 week, you don't understand what we are talking about. And even at the end of the week, you won't be able to manage a supply chain management, a supply chain of health product. It's too complicated. It doesn't require 5 days or 1 week. It requires much more time. So can you imagine the consequences on the supply chain or the health system when you follow a training when you just sleep 80% of the time? That's not good enough. Next slide, please. So here it's very interesting slide. You see at the left side you have the availability of qualified personnel all over the world. You can take operators, administrative logistics supervisor. You see, we reach maximum 40%. That means the availability of qualified person is very low. We don't have the personnel. We don't have the human resources. That's why those who want to work on the supply chain management must think that we have opportunity, we have career to be on this supply chain business. When you see at the right side of the screen, you see the big guy. It's the human resources required. So you have the big guy. In the middle, you have the human resources available, and at the end, you have human resources effective. That means we have very few qualified people able to work on the supply chain. It's very obvious. You see, this slide speaks by himself. Okay, next slide, please. So this is one report from the Global Fund. Maybe most of you knows about Global Fund. Global Fund helps to fight HIV, tuberculosis, and malaria in many countries, especially in Africa, in Asia, in South America. So they provide a lot of money, and you know about them. I mean, we are talking about billions and billions dollars who are in this system. And this report is from 2017, but it didn't change a lot. he said that supply chain related vacancies rate up to 71% in public sector posts. This is terrible. When you see that, you know that in the public sector, you have unqualified people in the supply chain. That means if you have unqualified people in the supply chain, your supply chain is poorly managed. And when it's poorly managed, that means the patient didn't get their medicines, didn't get their commodities. It's a nightmare. And this is all over the world, not especially in Africa, but it's in Asia, it's in Europe, it's all over the world. So this is the Global Fund who say that. That means there is an issue with the personnel, with the capacity of the personnel, and with the recruitment. Next slide, please. But you're gonna say, because all of you are quite young, you say, okay, why we need to train people? Technology will take over soon. Well, that's false. That's a mistake. If you think that robotics, AI will end over the business, that's wrong. That's wrong. They may help you, they may support you in many things, many areas, but they will not replace people. They will not replace staff, especially on the supply chain management. They may replace some people in the finance. That's possible. You are dealing with numbers. But on supply chain management, it's not possible to replace humans. And you will see on the next slide, please, that the private sector, on the figure number 3 on the right side, 69% of the supply chain leaders agree that people are essential to the supply chain resilience. Not technology, not computer, no AI. People. They need people. So you need to understand that the private sector, the public sector need people. They are fine with computer. They can have that, but they need people. If one day you have to face, let's say, a pandemic like the COVID-19, your AI will not help you. You will face one catastrophe, one earthquake or something like that. You will need to take a decision right away. You will not go back to your office, try to find on internet or on your AI what to do in case of this problem. No. Your brain need to gear on and you need to find solutions. Next slide, please. So Empower estimate that over 30,000 people need to be trained right now. And these 30,000 people are currently working right now in the supply chain management. Maybe they are pharmacists working in the supply chain in a public sector, and you cannot send back to the university to learn about the supply chain management of health product. It's not possible. It's very complicated. But nowadays, we have the opportunity with Unitar and Empower to provide you courses online, which is much better. Why? Because you are still working, you have your duty, you have your professional obligation, and you cannot stop that for 1 year and go to university. You know that you have a lack of knowledge or lack of some skills. You know where they are. You know that you have a problem on that and on that, and you need some training. Well, Unitar and Empower will propose you some training online, and you can take over these courses whenever you want. Next slide, please. So what do we need? Which kind of skill do we need when we want to work on the supply chain management? You need a lot of skills, in fact, and knowledge. You need to understand and to operate procurements. Procurement is quite complicated. You need to manage and to have some knowledge about the risk management. The risk management, you study that. Did you study in your university how to manage risk? Maybe not. So we will teach you how to manage risks. You need to understand very simple things, temperature deterioration or shelf life impact required for specialized product. You need as well to understand the famous G. We have GMP, we have GSP. This is good manufacturing process, good storage process, good delivery process, good laboratory process. All these process, you need to know them. You need to be familiar with that because you're going to work every day with this process. And the list goes on, goes on, goes on. So it's not an easy task to learn the supply chain management of health product, but we will help you to do that. And you have opportunity to learn and to have a very good career in this specific area. Next slide, please. For example, if you are a pharmacist, you say, "Oh, guy, I know everything about the medicine. I know the name, the complicated name. Complicated name. I know all of them. All of them. I mean, I'm very good on that." Yeah, well, we don't need only medicines. You need to know everything. You need to know medicines, of course, but you need to know medical and surgical sundries. For example, you need to know about mask, about PPT. You need to know about everything, medical equipment. The medical equipment, it goes from $10 to $1 million. You need to know them. You have X-ray machine. When you procure X-ray machine, you don't say, "I want an X-ray machine." No, you need to provide specification. If you have X-ray machine in Africa or in Asia, you may need 220 volt or 110 volt. It's stupid what I'm talking about. But if you plug 220 volt on something 110 volt, $1 million machine, broken, because you didn't procure correctly. So you need to know a lot of things. You need to know about laboratory. You have 3,000 items, medical equipment, 3,000 items, maybe more. So you need to know and to learn about that. Did you learn in your university or in your school, at your school? Maybe not. So you need to learn about that. Next slide, please. For example, GSP, Goods Storage Practice. Most of the product have a nominal storage temperature, not above 25 degrees. So most of you may know that. If the temperature increase from 10 degrees, there will be a deterioration. If the temperature increase above 40 degrees, more than 12 hours, there will be much more deterioration. Above 50 degrees, it will be a nightmare. That means your product was a shelf life of 2 years. Because of the temperature, will be reduced by 1 year. That's a possibility. And you need to know that. You need to know that. You need to understand how to do in case of this kind of problem, especially in your country, when there is no air condition, when you receive a product with the transportation during 3 months above 50 degrees, you need to know and to understand what to do. Next slide, please. So for that, we have I think the pharmacists, they know Arrhenius equation. You have this small equation down below, very easy one to calculate. And when you know this equation, you will say, "Okay, I'll sit down on my desk and I will calculate and I will see what is the temperature in my stock during 1 month." So no, it's not possible. We have right now tools cost $20, and you put these tools in your storage, in your stock, and it will calculate automatically the average temperature, and you will understand what is the deterioration for 1 month, and you will understand that your product was not stored at the right temperature, and the deterioration was 1 month or 2 months according to the shelf life. So do you learn that at school, at your school? Maybe not, maybe yes, but this $20, let's say, tool may save you entire supply chain management. Next slide, please. In the courses we propose and we develop with a Unitar, cover a lot of areas. We will go deeper on these areas, but you will follow webinar. You will have some exercise. You will know some equations. You will know how to conduct procurement, how to manage risk management. You will maybe discuss with some private sectors. You will follow course on leadership, on management. This is a very huge course we propose to you, really to improve your skills and your knowledge, and to achieve something you never think before, and to go to one new job and new career, supply chain management. It's something, believe me. Next slide, please. But you need as well to learn from past experience. Most of you, I think all of you, you know what's happened during the COVID-19. It was a nightmare. It was a nightmare simply because the supply chain management just exploded all over the world. The supply chain management was not resilient enough. It was catastrophic. It was brutal all over the world. Why? Because we were not prepared. We were not prepared, and we should be prepared. On the COVID-19, on the next COVID-19, on the warming, global warming, we need to be prepared. We don't have to talk and say, yes, we know. No, you need to be prepared. You need to to have experience for what's happened during the COVID-19. If you say, okay, COVID-19 is over and out, it's over. But for example, why during the COVID-19, your anti-malaria didn't come or didn't reach your country? You ordered, but it didn't reach your country. You need to know why. We are talking about COVID-19. Why anti-malaria? We don't receive anti-malaria. So I will explain to you shortly on the next slide. This is a reminder, maybe API, it's active pharmaceutical ingredient. That means it's a part of the medicine. It's a chemical substance intended to produce the desired pharmacological effect. And what's happened during the COVID-19? 80% of the API come from China and India. India was sourcing 70% of API from China. And where from China? From Wuhan, where the COVID-19 started. That means when China closed Wuhan, you don't have any more API. And if you don't have any more API, India cannot manufacture the ingredients. And when India shut down and closed the factory, no more ingredients, no more product, no more anti-malaria, no more. Why? Because all of the suppliers are in China and in India. Next slide, please. So it's where we go. Risk management. This is a very tough subject because on the risk management, we were not ready for the COVID-19, as I mentioned, and we should have been. And the problem, we need to measure, let's say something, I will digress, but it's very simple. All the countries all over the world, they have a preparedness plan for emergency or for this kind of COVID-19. All of them, they have a plan, but they didn't try it. 99% of the country didn't try this preparedness plan against let's say COVID-19 or any disaster. They didn't try. They have a plan in place, but they never try it. That's why we fail on COVID-19. All of us fail. So what we need to do, we need to measure risks, understand risks, and mitigating risks. We can't mitigate all the risk, but we can understand the risks management and apply evidence-based procedure to be better. So when a disaster or epidemic hits, we already know what to do. We are better prepared. So this is a very important part of the training, risk management. Know the risk, write down the risks, propose solution, mitigate the risks. Next slide, please. For example, we have maybe some of you or most of you knows about quality control and quality assurance. Usually, when we receive product in a country, we have to sample some product and send to one pre-qualified laboratory and to check if the product is good enough, if it's not spoiled or whatever. And that may take time and a lot of money. Nowadays, we have this small equipment, cost a lot of money, $40,000. But at least when you take this small equipment, you put on the medicine, you want to even the blister directly, and it tells you if it's a good one or not. Only that. You don't need to sample, and you don't need to send to a broad laboratory. Very simple. You don't lose time. It's 2-3 minutes time to have the result. So it's very simple. So what is your solution? To send the product for sampling abroad costing $1,000, or to have this small equipment at your warehouse and to be able to conduct some kind of sampling right away. This is risk management. Okay, it's one of the risk management. Next slide, please. So these are the courses we propose about supply chain management. Of course, you may find a lot of on internet. You may find quite a good one on internet, of course. But what we are talking about is here, it's supply chain management of health product. And you don't have 1,000 courses. online on internet. And I don't want to say that Unitar and Empower are doing the best courses ever, but we are pretty sure that we are doing quite well. So just have a look about what we provide, and don't forget that Unitar and Empower is supported by UN organizations such as WHO, which is a World Health Organization, which is something. Sorry, next slide, please. So, what is this famous courses on Masters of Science proposed by Unitar and Empower? Well, you will not become lawyers, but you will learn a little bit about laws and the impact on the procurement. You will not become accountants, but you will learn a little bit about accountants and how to undertake inventory management. You will not become politician, well, but you need to understand about good governance. You will not become statisticians, but you will know to use algorithm and statistics. You will not become health economists, but you will know about quality and daily. Maybe you know a little bit about that, but I'm pretty sure that all of the students who follow Empowers and Unitar course knows about quality and daily. And you will not become a data expert, but at least you will know how to use computers and inventory management and forecasting with a computer or not. Next slide, please. So you tell me, do I need to know all this? I mean, law, good governance, inventory management. Do I really need to know all this? Yes, you need. Yes, you need. Because if you want to embrace the career of supply chain management of health product, you need to know all of this. You don't need to be perfect. Nobody is perfect, but you need to know all of this because you will be a leader. And a leader is supposed to lead. And leading means knowing, having skill and knowledge. Means many things as well, but this is very important. Yes, you need all of this. You need to know all of this. Next slide, please. Well, the course should aim, the overall aim to empower. It's to empower you on the PSM, Procurement and Supply Chain Management, which is of health product, of course. PSM, Procurement, Supply Chain Management. We are using this word, but some people ask me, what does it mean, PSM? Yeah, PSM means Procurement and Supply Chain Management of health product. Okay, to become a leader, a manager, this course will help you to become a leader and a manager. It's very important. You need to be a leader. People need to follow you. You will be responsible of many activities with many different profiles. If you're not a leader, you may collapse. I mean, your supply chain will collapse and you will not reach the objective. You know what to do and you will be able to advocate as well, to get the resources, to get the staff, to get everything you need to get the job done. Next slide, please. The opportunities, the opportunities are very simple. We don't need pharmacists. We don't need logisticians. We need pharmacists having a knowledge of the supply chain management of health product. We don't need logisticians. We need logisticians having knowledge on the public health. So we need both profiles. You are an IT specialist, you are a finance specialist, doesn't matter. You're welcome. You can come here, you follow the course, and believe me, more than 80% of young professionals working in the supply chain say that it was the right career choice. So whatever is your profile, we take it, we train you, and you become what we wish you to become, a leader in supply chain management of health product. Next slide, please. So here you have some kind of UN job. Okay, I put 3 pages with a UN job. You will see that they need a head of operation, they need a pharmacist, they need a senior scientist, they need a lot of profile. The United Nations all over the world need profile, supply chain management of health product profile, a lot. So this is just a small list. But if you go to UN job, you will see a lot of list of for requirement of profile needed. Next slide, please. This is the same from MSH, from Chemonics. You will see that this organization tried to find a very specific profile on supply chain management. So you can try to find on internet as well. Next slide. Well, it's another one. So you see a director of production and supply chain. So all these people they try to find need to have a specific profile, public health profile and supply chain management profile. Okay, next slide, please. Okay, next slide. I think we are pretty close to the end. So we need anyone. I mean, pharmacists, doctors, scientists, engineers, staff, administration, whoever is ready to follow this Master of Science courses is welcome. Just maybe Sonia or other may explain to you how to apply, but should be fine. Next slide, please. Well, summary, it's the COVID-19 was a very tough moment for everyone, and the PSM has been a Cinderella operation for quite a lot of time. And the fact that the COVID-19 highlighted that the supply chain management was catastrophic, that helped all the country to get more money, to give more attention of the procurement and supply chain management, or the supply chain management of health product. So the MSc courses, that's been a Master of Science courses, specific to public health and low and middle income country, can provide you with the ability and the confidence to operate healthcare PSM efficiently and effectively. Bear in mind that we are building leaders. You are a leader already, fine, but we will improve your leadership. Next slide, please. So it's an exciting challenge. It's very long. You will not do that in 1 month or 2 weeks. It's very long. It requires a lot of time, patience. You will have mentors. You will have possibility to speak to the private sector if needed. So don't worry, you will not be alone during this journey to the Master of Science. Next slide, please. Okay, this is a conclusion, but you can replace pharmacists by whatever you want. So there is always a difference between simply being a pharmacist and being a better pharmacist. Training in supply chain management will make the difference. Very simple. Those who are trained in supply chain management will be much better in their duty. I can guarantee you 100%. I know because I trained myself on that. So, okay, that's all for me.
Thank you. Thank you very much for your insights and your thoughts on how building a career in health procurement is essential to effectiveness of health systems worldwide, and to letting us know which are the courses that you need to have alongside Empower have. Now we are in a little bit of a time rush, so let's move on to the next speakers. Who will share their experiences from studying a course in health procurement. I would kindly introduce Ms. Maida Escamanga, who has developed a career in global health procurement, supply chain management, and business administration. Please, Ms. Maida, the floor is yours.
Good morning, good afternoon, wherever you are. I hope you can hear me.
Yes, we can hear you.
All right, my name is Maida Escamanga, a Malawian by nationality, but I'm based here in Liberia, in West Africa, in case you don't know where Liberia is. And I'm also one of the outgoing student for the Master in Global Health, Procurement and Supply Chain Management this coming August. Allow me to extend thanks to Empower School of Health for the opportunity granted to me to study at this prestigious school. and also the same extension to the staff and management of the Empower School for all the support rendered to me during the studies, the encouragement, and lastly, I appreciate my classmates and even the cohorts for the wonderful and the experience during the live learning session that we had. The contributions made me to reach this far. Now, let me talk about how I ended up joining the Empower. My choice to do both procurement, postgraduate diploma and Master of Science level training on global health procurement and supply chain management was very intentional for my career because there is a great need for people in business management to be involved in global health management and procurement. It appeared to me that maybe I might not manage the course, but believe me, with the background of Bachelor of Commerce in Business Administration, I thought it would be very tough for me, knowing that maybe it's usually the pharmacists or doctors who go for this course. But to my surprise, I enjoyed every topic of the course, the case studies, the sessions we had because of the excellent delivery and the package of the training, the content that the school has packaged in. The course is delivered in such experimental and real world environment with case studies and live interactions with the academic staff and other alumni. We really thank the school for that. It was really rewarding to me, and I didn't face much challenges on that one. I really appreciate. And now how the course has helped me, honestly speaking, I'm no longer the same person I used to be before pursuing this course. I have accumulated so much knowledge and deep understanding of the public health procurement and supply chain management and even their systems through this course. Otherwise, all in all, I say thank you so much. This course is really enlightenment to my career, and the things that I didn't know, now I'm able to see them and I'm able to know them through the insightfulness of the course using the PSM framework, starting from product selection. We talk about forecasting, talking about quantification, procurement, inventory management, distribution, up to the end user, who is the patient. Our focus is the patient in this course. So everything I've learned through this course, and it's really quite beneficial. And it's not only this, there are a lot of topics involved in this course. We talk about pandemic and emergency preparedness. We talk of risk management. I think much have been said in the presentation by Nicholas. There are a lot of things. I've known the public health system through this course. I was just seeing hospitals, facilities, but maybe we just find the medicine there, but we don't know how the process it took to procure and even to deliver to the patient. But through this course, everything has been just amazing and challenging at the same time, but very interesting. I'm so confident and ready to contribute to the world of procurement, of health procurement and supply chain management, given any opportunity, because I'm well equipped. Talking of the benefits, let me encourage those who intend to start this course. You will not go wrong with this course, and you will not regret. The benefit of the course surpasses the fear or any negative doubt that you can have. You will never be the same again going through this course. And I am sure everyone who has gone through this course, I think everyone has got a story, can narrate on his or her own part. But to me, this course is so helpful and it has really changed my life. And I thank Empower of School of Health for this. Some of the benefits that you are going to have when you intend to start this course or you have decided to join this course is fully packaged, touching all areas concerned with supply chain management. We are talking supply chain management, we are talking of medicine, procurement, procuring medicine from the global, where they are, from the supplier part coming to your country up to the facility level. We are talking about the whole system. With this course, you are going to enjoy it, and it's going to highlight all areas, issues involved, and even the best solution that you can do, or you can engage yourself into it, and you can transform and improve whatever you're going through. And secondly, taking this course, the goodness is that it's a safe course, it's a safe paced by design, which means at any time you can start your studies, you can stop and restart again at your own inconvenience time. So that's the goodness of it. And we also use the artificial intelligence powered learning and instructional design to make learning easy and impactful, and it's really impactful to our lives. The last one, students, you not just learn theory, not just learning something that you can just read, but you are also going to enjoy the practical global use of case studies throughout the course. And lastly, the staffs are always there, providing technical support wherever you need. They're always there, helping you through as long as you communicate. As
I'm
long
gonna
as
head up
you
and get
reach
some
out
lunch
to
with
them.
the call.
In my conclusion, all I can say, I think maybe let me end with this proverb that says, one man's meat is another man's poison. Meaning, whatever is pleasant to me or whatever is good to me cannot be good to somebody. But throughout the course, you may find some areas very difficult to understand, some areas easy to understand, but all you need to do is just to put more effort and be open-minded. Tell yourself that you're going to do it, and yes, you're going to do it. Now the motto, you just say, if others have done it, what about you? What about me? I've also done it. I think in that way you find everything, every topic very easy and very interesting. I think let me stop it there. Thank you.
Thank you very much, Midas, for your very interesting thoughts and insight on your career. As we are running towards the end of this webinar, I would kindly ask you if there's any questions to put it on the Q&A, or also our colleague Sonia will share the email from Empower to ask questions. And to wrap up, I will kindly give the floor to Emmanuel. He will provide background on his experiences and share his career with us as Assistant Chief Pharmacist at Vine Pharmacy. Please, Emmanuel, the floor is yours.
Hello, everyone. Do you hear me?
Hello. Yeah, we can hear you perfect.
Yeah, thank you, everyone. Thank you, everyone. I'm glad to be here too, and as one of the one who took the course with the Empower. If you allow, I can share something from my page. But I don't think it will work. Sorry, let me talk a little bit, complimenting what Midas had been saying. I apologize, my computer is not working well, but we will try to communicate. So, as I said, I'm glad to join you today and share my journey through the master's course from the Empower School of Health in partnership with INTAR. My name is Emmanuel Shibiman, and I'm a Rwandan by nationality, and I'm a pharmacist. And over the past years, this program has profoundly shaped my career trajectory. Of course, I extend my heartfelt gratitude to the organizing team for this opportunity to reflect on how this program has influenced my professional growth and skill development. My journey started back in March 2021 when I enrolled in the postgraduate program. And it's a decision which had not been influenced by my employee or my employer or my professors. As naturally, I'm a lifelong learner, and I got hooked up by an inspiring journey of one of my LinkedIn connections, who is Comfort Tanaka. He was sharing he was celebrating the completion of an introduction to the procurement supply chain management, which is also one of the Empower School of Health Learning program. And by landing on the Empower School of Health website, I was immediately captivated by diverse courses available and their flexible learning options, but also flexible payment options, including scholarships too, which motivated me to aim high and pursue a postgraduate diploma. From that time, by that time, the postgraduate was the highest available on the website. But now we do have a master's, and I will come back to it too. My undergraduate formation is pharmacy. I'm a pharmacist, as I said, and I was an hospital pharmacist by the time. But the postgraduate diploma in global health procurement and supply chain management enriched my knowledge with a comprehensive blend of theoretical and practical applications. So the curriculum exceeded my expectations, covering essential areas from procurement, supply chain management, to quantification, supply planning, inventory management, and leadership, which are very crucial in today's dynamic supply chain industry. And the 12-month program not only filled me with the knowledge, but also boosted my confidence. I can share with you that after graduating with the postgraduate diploma, I successfully negotiated a significant raise and expanded the responsibilities from my employee, who recognized my dedication and the newfound capabilities in me because of my performance and my skills that he was seeing in me. But also, while thriving in my professional role, I received an exciting news about the master's program opportunity through the Alumni platform. We do have an Alumni platform, and that opportunity was something that I have to eager seize. Also, one of the most rewarding aspects on the master's program was the emphasis on lessons learned from the impact of COVID on procurement and supply chain management. That included the risk management in uncertain situations, the PSM for medical devices and diagnostics, and integrating new technology in health supply chain management, but also, for instance, the module on risk management in public health procurement challenged me to apply theoretical concepts to the real world scenarios. And this resulted in tangible outcomes also that influenced my learning and prepared me to the complex challenges ahead. But beyond the academic curriculum, the master's course offered abundant opportunities for personal and professional growth. From here, I can share with you that I participated in the event, which was very important in my life. From here, I can share the physical workshop on the step 2, which happened in Kigali, but also have been able to participate in the PTD Global Indaba in Bangkok, the one that Nicholas presented earlier. And this has broadened my perspectives and established a connection, established a valuable, to just help me to establish valuable connections within the health supply chain industry. But also on my experience, I confidently say that the master's course not only equipped me with technical expertise, but also instilled in me a sense of adaptability and resilience needed in today's competitive landscape. It has prepared me to navigate the supply chain industry with confidence and is opening doors to exciting new careers opportunities. Since I'm not yet graduating, but I have started just to touching those tangible opportunities in my country, and I believe that also there will be many, many, many doors outside. To prospective students considering this program, I urge you to embrace this transformative journey, just Master of Science in Global Health, Procurement, and Supply Chain Management, or other programs offered by the Empower School in partnership with UNITA. So the purpose is not just acquiring knowledge, it's also about refining your skills, which will expand your horizon and will prepare you to make a meaningful impact in your chosen field. Yeah, the school is very rich and the options are many. It's up to you to just to grab what you want and just make the effort. And it's not very difficult, as I know, as I have said. I did the courses while also doing my day-to-day work, including the added responsibilities, but I managed to finish the course on time, and I'm expecting the good results ahead. As also I said earlier, there are many opportunities in my country. I started to see what I can do in the private sector, in the many some opportunities like Save the Children in Rwanda, but also I have identified my potential in Rwanda Medical Supply and the other institutions. So there are many doors which are open to me in the coming future, which I really see that I will fit in. And I encourage everyone to take the course or to take another program on the website. There are many. It's up to us to grab them and run. I thank you.
Well, thank you very much, Emmanuel, also for sharing your experience and your thoughts on the courses in Empower. I'm sure that this two perspectives have been very helpful. We have set the Empower email in the chat for any further questions or requests. I've also sent in the chat the UNITAR and Empower School of Health website to check out the courses, the deadlines, etc. And now we will conduct the last poll very fast to see what has been the lessons learned from this webinar, and then we will shortly end up this webinar. Let me go back and share and launch this second poll here. So please, if you can kindly participate in this poll for us to have more information about who is the participants, what are you interested in which topics or areas we should do the next webinars on that you find interesting. Please let us know. And I remind again, we've sent the Empower School of Health email in the group chat so that you can send there all your requests if you want additional information, plus the UNITAR and Empower School of Health websites. Thank you. I would invite more people to participate if that would be possible. Thank you. So far, 94% of the people participating have found the information useful. 95% are interested in exploring digital health courses. Most of them are interested in digital health and global health as their areas of study, and data management and supply chain. And most of the audience is interested in master courses or 12-month courses. There is division with most of them want to grow within the organization they're already working at, and others they are highly interested in working at the United Nations. So let's see what people participating. Half of the attendees have participated already. We are 10 minutes into our deadline of time. So I think I'm going to end the poll now. I'll share the results for the poll. So it's see like 98% of the people participated found it interesting. 98% are interested in exploring digital health courses. The areas of studies are mostly global health and data management. The type of courses and trainings interesting in are mostly master courses. And they are mostly looking to grow within organizations or a job in the United Nations. So with this, we conclude this webinar. We thank you for your time and also for sharing these experiences and stories linked to health procurement. Thank you, the panelists, for sharing their thoughts and experience. And we hope that this webinar has been illustrating and helpful. So thank you very much.
Thank you, Mariam. Thank you, Manuel. Thank you, Maidas. Thank you, Sonia. And thank you, all of you. Have a good day.